Classification, trabecular mechanisms, complicated cataract, heterochromic cyclitis, low-grade asymptomatic uveitis, fine delayed keratic precipitates are present, the involved iris is lighter in 90% of cases, and secondary open-angle glaucoma occurs in 10 to 50% of cases. Complicated cataract, chronic uveitis, occurs in sarcoidosis or juvenile rheumatoid arthritis, where the rheumatoid factor is negative, antinuclear antibody is positive, and it occurs in the post-articular type. Retinitis pigmentosa, in posterior subcapsular cataract. Intraocular tumors, ciliary body tumors compress lens inducing posterior migration of lens cells. Unexplained unilateral lenticular astigmatism or focal cortical cataract in middle-aged individuals should warrant careful ciliary body and retina evaluation, as in medalloepithelioma compressing lens equator. Glaucoma flecken, focal areas of lens epithelial necrosis with associated cortical damage, post-acute congestive glaucoma, may represent toxins in stagnant aqueous. Cataract associated with systemic disease, myotonic dystrophy or Stayner disease. There is delayed muscular relaxation after cessation of muscular effort. This is an autosomal dominant disease. The chromosomes involved are 19q, 13, 3. Unstable CTG trinucleotide repeat accumulation. Systemic findings include myotonia, muscle wasting, mournful facial expression, frontal baldness, testicular atrophy, cardiomyopathy, and pulmonary disease. Ocular findings: presenile cataract with polychromatic anterior and posterior subcapsular cortical crystals, spirally birefringent concentrically multilaminated rice grains. Fabry's disease: sphingolipidosis disease with storage of ceramide trihexoside in corneal and lens epithelium, heart, and kidney. It is due to X-linked deficiency of alpha-galactosidase A. Ocular findings include vortex keratopathy, cornea verticillata, or Fleischer-Gruber in 90% of affected males, posterior spoke-like opacities of the lens. Endocrine cataract, diabetes mellitus, pathogenesis of diabetic cataract, normal glycolytic pathway overwhelmed by elevated glucose level. Insoluble sugar alcohol sorbitol is synthesized by the aldose reductase pathway. Osmotic cataract formation results from osmotic water influx and swelling of the lens fibers. Lenticular hydration alters refractive power of the lens, myopic and hyperopic shifts. Glucose adds phosphate in the presence of hexokinase enzyme, giving glucose 6-phosphate, glycolysis, hexose monophosphate shunt, or Krebs cycle. Glucose gives sorbitol in the presence of aldose reductase. Sorbitol is further converted into fructose by polyol dehydrogenase. True diabetic cataract or snowflake cataract. It occurs in young juvenile diabetics with uncontrolled diabetes. There is abrupt bilateral diffuse progressive subcapsular opacities. The lens capsule shows vacuoles and white punctate subcapsular opacities, snowflake configuration. The cortex shows cleft formation. Intumescence and maturity of the cortical cataract follows. Senescent cataract is an age-related lens change that occurs earlier in diabetics due to sorbitol accumulation with hydration changes and increased glycosylation of proteins in diabetics. Toxic cataracts, corticosteroids, posterior subcapsular cataract related to dose and duration of steroid use. It occurs in 12 to 60% of patients with chronic daily dose of steroids equal to 10 milligrams. The incidence is 20% if patient receives more than 15 milligrams of prednisolone for 2 to 8 years. Anticholine esterases, ecothiopate iodide and dimicarium bromide. Anterior subcapsular vacuoles in 84%. Not seen in children treated with ecothiopate for accommodative esotropia. Naphthalene, DMP, tripyranol, and mercury. Phenothiazines, chlorpromazine, and thioridazine. There are axial pigment deposits in the anterior lens epithelium. Amiodarone. This is an antiarrhythmic drug, causing stellate anterior axial pigment deposits. Traumatic cataract. Mechanical injuries include perforating injuries, ruptured lens, and physical injuries caused by radiation, electric injury, or chemical injury. Contusion. Vosseous ring, iris pigment on lens capsule. Traumatic cataract, patelliform cataract or contusion rosette. Dislocation and subluxation. There is rapid equatorial expansion secondary to anteroposterior compression. Ionizing radiation. Posterior subcapsular opacification occurs. Low doses in young age can induce damage, 200 Sig-Ray in a single fraction. Infrared radiation or glassblower cataract. Ultraviolet radiation, ultraviolet B with 290 to 320 nanometers wavelength, induces cortical and posterior subcapsular cataract. Electrical cataract. Electrical shock involving the head region induces protein coagulation and anterior subcapsular cataract formation. Argon laser cataract. Blue light absorbed by yellow sclerotic nucleus, avoided with green and red light.